Good evening, everyone, and welcome to Hines VA Hospital's virtual Women's Veteran Town Hall. I'm Angela Morris. I'm the Associate Director of Resources here at Hines, and I just want to say that we're deeply honored to have you today, especially because you served our country and you are our nation's heroes. Thank you so much for your courage, dedication, and resilience. Some of you we know have faced adversity and many challenges both on and off the field. Your service has been very instrumental in safeguarding our freedoms and upholding the values we hold dear. At Hines VA Hospital, we recognize that your experiences and needs are very unique. You are not just veterans, but also trailblazers who have paved the way for future generations. Your strength and perseverance inspire us all, and we are proud to acknowledge your contributions. Tonight's town hall is an opportunity to learn and ensure we provide the highest quality care and support tailored to your unique needs. You'll hear about many of our women-specific services and resources tonight, and we hope to see you all soon, walking in our hallways. Thank you again for all that you have done and will continue to do for our nation. And that opens tonight's town hall. So I'm going to turn it over to our Women Veterans Program Manager, Ms. Brenda Fritz. Thank you.
Good evening, everybody. My name is Brenda Fritz, and I am the Women Veteran Program Manager for the Hines VA. We are really excited to have this town hall to show you all of the wonderful medical services that the Hines VA has for you. Women veterans are one of the fastest growing populations in the service, and we are welcoming you with big arms to come and experience all of the wonderful medical opportunities that we have for you. Tonight is just going to be a sample of all of those programs available. So please take some time to listen to our speakers, share this with other veterans that you have, and reach out. We would love to see you here at Hines.
Good afternoon, women veterans. My name is Hapsi Kalapala. I am the Women's Health Medical Director, and I am internal medicine doctor by training. First, me and my colleagues at Hines Women's Health Program want to thank you for your service for the country and also giving us an opportunity to serve you for your health care needs. Today, we are excited to share some of the things we are doing at Hines facility to improve the care of the women veterans. I'm going to talk a little bit about the primary care. We at Hines facility, we have more than 30 primary care providers, and they are called designated women's health providers. To be a designated women's health provider, the PCPs need additional training. This will give them the opportunity to diagnose and treat complex healthcare needs of women veterans. These PCPs provide compassionate care to women veterans of all ages. Women's health primary care providers are located both at the main campus and at the 6 community-based clinics. Hines facility women's health providers at the Women's Health Clinic practice at Women's Health Clinic, and this Women's Health Clinic is a one-stop shop where multiple services are provided to the women veterans at one place. At the 6 community-based clinics, at least 2 or more designated women's health providers are present, and they provide the care for the women veterans. These are some of the services provided to women veterans at the Hines facilities. Primary care service, weight loss clinic, gynecology and urogynecology service, maternity care, psychiatry, psychotherapy, substance abuse program, physical medicine and rehab services, pelvic floor therapy, chiropractor service, acupuncture, chronic pain management, both medical and interventional pain management, preventive cancer screenings, cancer treatments, genetic counseling and testing when needed, pharmacy services, recreation therapy, social work services, blind rehabilitation, and care of women veterans with spinal cord injuries. Our goal, as mentioned by the Associate Director, is to provide personalized, comprehensive medical care of the highest quality. Thank you once again, and I would like to introduce our next presenter, Marissa Rees, our maternity care coordinator.
Thank you very much, Dr. Kalapala. My name is Marissa Rees. I'm the maternity care coordinator here at Hines VA. Thank you so much for your service to our country. We really appreciate it. From fiscal year 2011 to fiscal year 2020, VA maternity benefits covered delivery hospitalizations for almost 40,000 veterans. The number of veterans utilizing maternity care benefits has nearly doubled over a 10-year period. The VA offers maternity care benefits for female veterans. Maternity care benefits include all prenatal care, ultrasounds, labs, genetic testing, labor, delivery, and postpartum care. They also cover high-risk pregnancies and covers the medical care for the infant's first 7 days of life. The VA also covers the follow-up and contraception, the follow-up care and contraception, and also covers mental health needs. Veterans receive electric breast pumps, maternity bras, and support belts. If the moms need assistance with lactation, the VA covers the cost of lactation consultants. And, okay. I'm trying to, okay. Maternity care coordinators are liaisons for veterans and assist veterans with navigating VA healthcare to ensure continuity of care. Maternity care coordinators also screen veterans for depression and provide maternity case management and maternity care coordination from the time the veteran finds out that she is pregnant through pregnancy and through the first year of the baby's life. Maternity care coordinators help veterans navigate healthcare services inside and outside of the VA. They help access care for other physical and mental health needs. They connect veterans to community resources. They help veterans cope with pregnancy loss and help veterans connect with care after delivery. They also answer questions about billing. The VA also offers the ROSE program. It's a program for pregnant veterans and new moms. It's offered via telehealth and is a 4-week group class. Veterans support each other in the group. We talk about all the changes that come with being a new mom, about how relationships change, how to ask for help, how to communicate effectively, and self-care and relaxation. In September, we are having a drive-through baby shower event for expectant veterans who are in the VA maternity program. I would love to, my contact information is on the slide, and I will be introducing Dr. Lisette Rodriguez from Reproductive Women's Mental Health. Thank you for your time.
Thank you for that introduction, Marissa.
Oh.
So hi, as she said, I'm Dr. Lisette Rodriguez Cabezas. It's an honor to be here to present to you the specialized services we offer in women's reproductive mental health. It's also an honor to just be here to talk to our nation's heroes. Thank you for being here for this Women Veterans Town Hall. So I'm gonna have you review the slides with me because I wanna make sure that you see everything that we have to offer and can follow along as I present. So our mission in the Reproductive Women's Mental Health Clinic is to provide evidence-based, patient-centered reproductive mental health services to women veterans, women spouses of 100% service-connected veterans, and transgender veterans. Across the lifespan, women may experience reproductive conditions and events that impact their mood. The primary focus in reproductive women's mental health addresses the intersection between reproductive health and mental health conditions, including depression, anxiety, and post-traumatic stress disorder. Reproductive women's mental health offers a range of services from one-time psychiatric consultation to time-limited medication management and all variety of different types of therapies. This particular type of mental health treatment is very specialized and quite frankly, pretty hard to find in the community, so I think it's a huge benefit that we're able to offer these specialized services to our women veterans. So here's a sampling of what we specialize in treating and what we are happy to meet with women veterans to discuss. So we address preconception planning and distress, so women veterans that are trying to get pregnant and want to find out what's the optimal way to address any mental health issues that might be present, and then preconception consultation about medications and various treatment options. Medications are only part of what we offer. We offer a lot of other services. So anybody who's interested in finding out about these services are more than welcome to meet with us. We also talk about contraceptive choice and the potential interaction with medications for mental health conditions. We address premenstrual mood exacerbations such as premenstrual dysphoric disorder. Any distress related to infertility. So if women are having difficulty getting pregnant and are having to go through specialty infertility treatments, that can be very anxiety provoking and really stressful, so we want to address those issues as well. Perinatal distress during pregnancy and up to 1 year postpartum, so we are definitely capable and happy to meet with women veterans that might be having some mood or anxiety issues during pregnancy and while breastfeeding or while postpartum. And we are also happy to talk about any women veterans who might have some concerns about medications or various treatment options during pregnancy or while breastfeeding. We also address reproductive trauma such as pregnancy loss, pregnancy termination, complications during labor and delivery, as these can all contribute to various mental health symptoms. We're happy to address perimenopausal mood exacerbations. During perimenopause, a lot of anxiety can be present, mood changes, along with the hot flashes, sleep disruption, and various other symptoms that might present during that time. We also address female reproductive system cancers, such as breast and gynecologic cancers, and the resulting mood changes that result from that. Gynecological comorbidities such as PCOS might cause some mood changes, so we're happy to see those veterans. And then any concerns regarding medication interactions between prescribed hormones for various conditions and medications treating those mood changes. So the psychiatry branch of our treatment, we have reproductive psychiatrists that can assist, again, with one-time consultations or multiple visits to best meet the needs of women veterans. We review each case individually, provide feedback based on the most up-to-date research about available treatments. The one-time consultation is basically a scheduled evaluation with the patient, and we can relay recommendations related to reproductive health and psychiatric medication options, versus ongoing care involves meeting with the patient and discussing medications and following them and just making sure those medications are working effectively and the patient is tolerating them well during pregnancy and postpartum is an example of that short-term care. Therapy is the other branch of treatment. We offer a variety of evidence-based treatment options that are clinically indicated to improve mental health outcomes related to reproductive health distress. And this is a list of all the different types of psychotherapy. So cognitive behavioral therapy, interpersonal psychotherapy, cognitive processing therapy, prolonged exposure, which is a treatment for CPT and PE are treatments for post-traumatic stress disorder, CBTI for insomnia, which is a common complaint at various stages in a woman's reproductive lifespan. So especially during pregnancy, especially perimenopause, women can have issues with sleep, so we want to address that. And then we offer time-limited skills-focused therapy such as mindfulness, dialectical behavioral therapy, skills training for affective and interpersonal regulation, which is STAIR, and then relaxation training. We also offer couples and group therapy. Group therapy, as Marissa mentioned, is the ROSE program. Since she discussed that, I won't revisit it, but for couples therapy, we want to support our female veterans and their partners navigating any challenges related to their relationship and the reproductive health events they might be experiencing. So referrals can be made from any primary care behavioral health staff, from the mental health intake center, from the maternity care coordinators, which you just heard from Marissa, she's our maternity care coordinator, or any mental health providers. If you have any questions related to any of the services I just discussed, please reach out to our point of contact, Dr. Kathleen Colangelo at 708-202-4761. If you're new to Hines, you can call the mental health intake center at 708-202-8387 and then dial extension 23446 to schedule an appointment and ask about a referral to reproductive women's mental health. I'm sandwiched in between two of my very close colleagues, so I'm happy to be kind of in the middle. So Marissa introduced me, and I am honored to introduce Dr. Annette Wilson, who is a close colleague in primary care behavioral health.
Hi, well thank you so much for that introduction. I think it works nicely when we have our maternity and different mental health clinics that we have. So my name's Annette Wilson. I'm a psychologist with primary care behavioral health. The first thing I want to say is at Hines we call it primary care behavioral health. Other VAs call it primary care mental health integration. So if you're coming from another VA, might be more familiar with that language. It is the same exact thing. We call it primary care behavioral health, or PCBH, at Hines. And so I'm a psychologist, and we're PCBH, we're part of PAC, the Patient Aligned Care Team, and we know that mental health is such a big part of health and impacts our health, and so we want to make sure that we're addressing those mental health needs. And so we see a variety of different mental health diagnoses, but then also things like sleep and pain. We have specific programs for coping with cancer. We also see caregivers, things like substance use. We also have peer support, and that can be a really great way to connect with other women veterans who can relate to some of the experiences that you may share. We see patients individually. We have different groups. We do in-person, virtually, that we know our women veterans are often pulled in many different directions, so we try to meet you where you're at, and I do a lot of phone sessions or virtual sessions from inside a car, and that we try to fit it in where we can, that we want to make sure we're addressing your mental health as well. We also have medication management support for helping getting on different medications and having a contact and support if you're experiencing side effects or you have questions. So what we do, a main aspect of primary care behavioral health is warm handoffs. And so what that is you're at your primary care appointment and you mentioned something, a mental health related issue, that we want to catch you while you're there. And so we have two different people, Chloe and myself, who are assigned to this clinic because we know that our women veterans, that mental health is a big issue that we want to make sure we have resources and we're addressing. And so we ask you those screening questions in primary care. Sometimes you just maybe rush through them, but we really want to know, hey, are you feeling more anxious? Are you feeling more depressed? So that we can address those issues. You can speak up at your primary care appointment with any member of PACT and say, hey, I'm interested in speaking with a mental health provider today, and we have two people assigned to the clinic that are there and we're ready to take that warm handoff. Sometimes our providers have such good relationships with our veterans, and so sometimes you maybe say no to the screening questions, but our providers or nursing staff kind of contact PCBH and say, she doesn't seem like herself today, that she said no to the depression and certain screening questions, but she just seems off. Can you go check in with her? So that's another way that we come in contact with people in the Women's Health Clinic. So for referral, all you have to do is talk to your primary care provider. We also have people in the women's health clinic, so if you're here at Hines and are interested in speaking with us or setting up an appointment, that you can stop by the women's health clinic and ask to speak with a primary care behavioral health provider. And so what we offer is brief therapy. It's very targeted. I like to say, you know, hey, what's getting in the way the most of you being successful in your roles and relationships? And we focus on that. And we like to call it the primary care dose of treatment. And we try some things. Maybe you've never been involved in psychotherapy. Maybe it's been in a while. So kind of a refresher or some basic skills. Sometimes we recognize, hey, you know, we do the functional assessment and recognize symptoms are maybe more in the severe range, or maybe there's a reproductive aspect to your mental health presentation. And so then we can also help connect you with the specialty clinics and clinics like reproductive women's mental health. Oh, well, here's all the information I just said. But I'm glad I didn't forget this. So this is something I want to really highlight, that Superwoman Revamped is a really special program that we offer in primary care behavioral health, and we are currently recruiting for our September cohort. I know it's a little bit of a ways away, but what this is, it's a 10-week program, and it's for our Black women veterans, and it's targeted to different things like stress, setting boundaries, that we know that there are additional stressors, and it really helps to connect with other people who have that identity. And so Superwoman Revamped, if you are interested in attending that group or getting connected with that program, you can, Amanda Pack is the contact. You can also talk to your primary care provider, in the women's health clinic. You can also talk to PCVH, that we want to try to make it as easy as possible to get you connected to these resources. And speaking of resources, we have our women's health social worker, Jamie Suber.
Thank you, Annette, for that warm handoff. I am Jamie Suber. I am the Women's Health PAC social worker here at Hines VA, and I'm going to talk a little bit about just the general overview of social workers within the patient-aligned care team. So the PAC team focuses on health promotion, prevention, and management of chronic disease. We look to assess and treat the psychosocial and environmental factors that impact the patient's ability to achieve maximum health and wellness. So a lot of times I'll get a warm handoff from a provider or anybody else on the care team and conduct an assessment that looks at patient support system dynamics, your functional status, vocational goals, economic situation, housing, spiritual, cultural, all of the things that could affect your ability to adhere to medical recommendations or just care for yourself. So we utilize the whole health model to empower and equip veterans to take charge of their health and well-being. And we provide case management from episodic check-ins a couple times a year to intensive monthly case management. This is all dependent on kind of the need for self-determination as well. We partner alongside of the veteran and we empower them to make their own choices. None of this is mandatory, it's completely self-directed. If you've ever come to Hines VA in the next coming months or the past couple of months, you may have been asked a series of questions, and that is part of a new initiative called ACORN. It's called Assessing Circumstances and Offering Resources for Needs. We're calling it ACORN. And so that is an assessment that kind of focuses on the social determinants of health. We recognize that there are a lot of social risks and things that can impact a veteran's access to care, and that includes 9 different domains. So food, housing, utilities, transportation, education, employment, again, all of the things. It also looks at social isolation and loneliness, as well as access to care needs, such as the ability to get a telehealth appointment or to do video visits if you have difficulty getting here to see your providers. So when you complete this screening, it'll typically be done by myself if you're in a women's health clinic or another PAC social worker, and we'll ask a series of questions. And if you screen positive in any of these domains, that kind of initiates that warm handoff to any of our other providers in PAC or other case management or other departments in the VA. And it starts an immediate handoff of resources that you can take home today for more information and for like direct intervention. Some of those examples of assessments include, like I said, the digital divide. So a console could be placed for you in order to get a device to complete telehealth appointments, referrals for financial and housing resources, warm handoffs to other programs, caregiver support resources, and then it also can start the conversation of advanced care planning. So talking about advanced directives and healthcare powers of attorney, or doing assessments for in-home services like homemaker, home health aide, getting a visiting nurse, and then as well as a conversation about higher level of care needs like transitioning to assisted living or supported living. So if you have any questions about social work services, I am here at Hines in the Women's Health Clinic on the 12th floor. Feel free to contact me with any questions. We also recognize that some women veterans are also getting care out in the C-box. If you are assigned to a PAC team, you will have an assigned PAC social worker. It may not necessarily be me, so feel free to reach out to your C-box to get your assigned social worker. Now I will be introducing our women's health pharmacist, Nick Super.
Yes, my name's Nick Super. I'm the pharmacist here in Women's Health Clinic. Not to be confused with Jamie Suber, our social worker, and to confuse matters further, we often share an office as well. So, much like this afternoon, I'm often finding myself in the position to be the one man in the room, or the clinic in this case. And that's actually not by coincidence. I've been working in women's health clinics in the VA for 15 years because I'm passionate about it and I'm fascinated by treating the unique needs of women veterans. So today I'm going to talk about the things that my colleagues and I can do for you as veterans here from the pharmacy service side. So our roles grow over time to adapt to your needs. And so what I present today may not be what is the case in the future. We might do more than I present today. So for starters, we'll talk about the outpatient pharmacists, who are the ones you probably most often see. So our outpatient pharmacy is on the first floor of Hines main building here, right inside the south entrance. And these are the pharmacists who you see when you get a new prescription from your doctor. They're the ones who process those prescriptions and verify them. Behind the scenes, they're calling your doctors to make sure that they're doing things, according to plans. They're catching issues that may have slipped through the cracks along the way, drug interactions, maybe labs that need to be done. They'll counsel you on those new medications and also process your refills for you. And they work with their technicians to make sure that everything's dispensed appropriately, correctly, you get the right meds at the right time. And they also track your mail prescriptions. When you call the pharmacy and say, hey, this med hasn't arrived yet, they're the ones who will do that. So the next group of pharmacists, my colleagues, are in inpatient pharmacy. So these are the folks who are either in the inpatient pharmacy, preparing medications to go to the floors, or rounding with your medical teams, helping to ensure that those medications are appropriate for you, that you have the right medication to get you home feeling better as soon as possible. They also make sure that the IV medications that are prepared in the pharmacy are safe and exactly at the right dose for you, and get there in a timely fashion as well. And then when you do get discharged, these are the pharmacists who are going to make sure you get the right medications when you go home. But those meds the doctor wanted you to go home on are the ones you get in the bag when you leave. So really crucial people in the team to get you back home feeling good. So then getting to the PAC clinics, your primary care clinics, including our women's health clinic here. So every PAC clinic at Hines has an assigned clinical pharmacist like myself. So these clinical pharmacists, or you often hear them called PharmDs, doctors of pharmacy, are there to help your doctor manage your conditions, chronic conditions such as diabetes, high blood pressure, high cholesterol, breathing issues like asthma and COPD, helping you quit smoking, and lots of other things. And again, this can evolve over time. What we do now may not be what we do tomorrow. So your doctor can refer you to the PharmD in clinic to help manage any of these conditions or others that may be appropriate for you. So the PharmD has the role of helping between those doctor's visits, because your doctor can't see you, every week, let's say, as often as they'd like sometimes. So in between those doctor's visits, your PharmD can help you adjust medication doses, change to different medications, start new medications. Or if you want to just review your medications, make sure it all makes sense to you. Why am I on this? Why is this 3 times a day? Why can't it be once a day? Those types of questions. Your pharmacist is there in clinic to help you with those things as well. They also can help monitor your labs and your blood work, and watch your blood sugar and blood pressure readings as well. And they can place referrals to other services as needed. So your PACT PharmD is there to do lots of things in collaboration with your doctor and the whole team here as well. So then here in Women's Health Clinic, My role that's unique here in women's health is to treat women veteran-specific issues. In addition to those disease states I mentioned on the previous slide, more women's health-specific things like birth control, menopausal symptoms. We're talking about safe medication use in pregnancy and breastfeeding. So these are all things that I am trained to do and love doing every day. So I'm located here at the Hines main clinic, the Women's Health Clinic on the main side here, but I'm available for referral from C-Box, for video visits or face-to-face if you want to come out here for track, a little bit of a track. Phone, video are possible as well. So any of those issues need addressing, your doctor, wherever you are, whatever C-Box you're at, can refer you to me to talk about those types of things. And so to kind of summarize what the PharmDs and clinic do. So for help with your chronic conditions, your diabetes, your hypertension, your high cholesterol, you get referred to your PAC clinic PharmD, who might be me if you're in the Women's Health Clinic here at Hines. But for help with birth control, medications in pregnancy, menopausal symptoms, those types of things, you can get referred to me in the Hines Women's Health Clinic, either in person or remotely. And my colleagues and I in the clinics are all available for in-person, telephone, and video appointments. So please ask your doctor for a referral if any of this sounds like it could be good for you. We're there to help you, and you served all of us. So thank you very much. I'll pass it along to our vocational rehab service.
Good afternoon. My name is Megan Staley, and I work with the Vocational Rehab Department. Many of our women veterans know by our former name CWT, or Compensated Work Therapy. I wanted to start off with this quote here. It says, "If you think work is stressful, try unemployment, social isolation, and poverty." So we understand that being unemployed or being in a job, frankly, that you just don't enjoy can be traumatic and can have a significant effect on your mental health. So that's why we are here to help you either find employment or find another job that you would really consider really enjoying. So who we are all master's level rehabilitation counselors, and we all went to school with a specialty in maximizing full integration of individuals with disabilities into the community. So we specialize really with women veterans who have sort of a wide range of mental health or any sort of physical disabilities to try and find work that you will enjoy, that you'll like, and that you're able to do. And many of us, with the certified rehabilitation counselor certification, many of us have state licensure, that we are able to help in a more of a different approach of that mental health aspect of trying to find a job. So we do collaborate with many of your other providers here with the VA, so we do like to work as part of your treatment team. So we'll work with your homeless provider, we work with your primary care doctor, we do work with your psychiatrist, therapist, to try to work as a collaborative team here to find you work that you will enjoy. For vocational rehab, we do have 3 different programs. The first program I'll talk about, you'll see on our slide here, is our supported employment program. This is going to be our highest level care and most clinical support. This is where our veterans receive long-term vocational assistance. It's really a lifelong job coach, so they not only help you find a job, but they help you maintain that job for as long as you'd like. This program is for our veterans who have been diagnosed with severe mental illness. When we talk about that, we're talking about schizophrenia, those veterans with hallucinations, psychosis, bipolar disorder. So maybe not every women veteran needs this program, but it is available for those who need that extra clinical support. Our most popular program many people know us about is our transitional work program. This is a time-limited program where women veterans are able to work here at one of our hospital sites here or at one of our clinics for 6 months. And that can be in housekeeping, greeting. We have people working as escorts, food service. So whatever you like to do or you might have an interest in, we really try to pair you with a good work site that we do have available. While you're in that 6-month program is when you're able to meet with a counselor regularly to transition you into permanent jobs. So we'll help you with your resume, we'll help job leads and all of that good stuff while you're getting at a paid work site here. Then the last program we have is our community-based employment program. So that is also a short-term program to help you find employment in your community. So a counselor will come meet you at a local coffee shop, library, even virtually, to help you with your job search in that sense. To be eligible for vocational rehab, we do need medical and mental health clearance for you to work, and you do have to be receiving medical care here from the VA. And really, other than that, your goal just has to be finding competitive employment here. So if you're looking for work, we will be able to help you. And again, we do try to take a different approach to finding you work. Not only are we just trying to throw you into any old jobs, we like to sit down, get an assessment, and get to know you as a person, identify your strengths, what you need, what you want to do to help you find employment that way. So on the slides here, you'll find a long list of good services and what we provide here for our women veterans. We not only help you with your job searching, but we also help with reasonable accommodation requests and advocacy, counseling services, case management, career counseling. If you're not sure what you might want to do, we can guide you and help you develop goals that way. Developing good work habits, conflict resolution, interview coaching. So any things that deal with obtaining or maintaining work, we are able here to help you. If you are interested in more, we are here at Hines Hospital on the 3rd floor of Building 13. We are also available at all of our C-Box here. We have counselors who cover all of these geographic locations. Our phone number here, it's 708-202-2959 if you'd like to call for more information. Or if you're already integrated with the VA system, you can go ahead and ask your provider for a consult for CWT or voc rehab. Thank you very much.
Good afternoon, everyone. My name is Candace Kent. I am the Veteran Experience Officer here at Hines VA. So a little bit about my role. I like to say in layman's terms, Veteran Experience serves as the customer service department for our veterans here at Hines VA. So I'm charged with ensuring that we provide the highest quality customer service experience to every man and woman who walks through our doors. We do this by partnering with VA staff to include our executive leadership team, also departmental chiefs and frontline staff, to really ensure we are equipped to provide excellent customer service and excellent care here at the VA. Additionally, we work to improve services, collecting customer service data to enhance our VA services. So we are constantly looking at surveys, veteran feedback, to really see how our veterans are experiencing the VA through their eyes, and ensuring that, again, that we're meeting that need. From there, we create solutions, implementing evidence-based practices centered on veteran-centered design to ensure we are meeting the needs of our veterans in every step of the way regarding their care. Lastly, but we make our veterans feel valued, listening to the customers and employees to create an effective and seamless experience through every aspect of your care here, from walk through the doors for primary care or mental health. We want to ensure that that experience for you is effective in meeting the needs of you and your family. So what does this mean for women veterans? We are listening and taking action. As the VEO here, I'm collaborating with Women's Health to identify gaps in care regarding gender-specific services, noting the changing landscape within the VA and also nationally. It's important that we kind of meet the needs for our women veterans, understanding they are the largest demographic coming into the VA. So we want to ensure that we are actually prepared for you as you come through our doors, not only now but in the future. So I'm attending women veterans focus groups, doing town halls, really looking to get feedback from our women veterans and their families about what we're needing, what they are needing from the VA at large. Additionally, again, we're drilling down on surveys and data to really get real-time feedback from our women veterans and their families. I'm always encouraging veterans to kind of contact me, let me know how we're doing here, be it we need to improve in reproductive care or in our mental health services. We're definitely here and listening to you. So with that said, I always encourage veterans to contact me directly if you have any questions, concerns about your care here. I'm always listening, again, trying to get that feedback from our veterans and their families about how we can improve services here, what we're doing well, what you all are needing here from the VA at large. So my contact number is here. Again, be it nothing too big or too small to call me about. I'm very passionate about the work we do here and ensuring we're meeting the needs of our veterans. And again, just reflecting that of the entire staff here, as you have seen today. We are very passionate about the work we are doing. And so again, any questions, concerns about your services here, feel free to give me a phone call. And that's all I have for you today, and thank you for your service.
So in closing today, I want to thank everyone who took the time to watch our Facebook Live. I have some contact numbers here, and I just want everyone in the audience to know that Hines is invested in the women veterans. We would love to take care of you here. Please call, contact us. We have services that will take care of all the needs that you have, from being very young and getting discharged to being a little seasoned. Thank you.